True or false, the appendicular skeleton includes the skull. A. True. B. False. The body uses 3 different sorts of energy systems to produce energy. Which of the following does the body not employ as an energy system to replenish ATP in skeletal muscle? A. Aerobic. B. Glycolytic. C. Oxidative. D. Phosphagen. The ankle is a multiaxial joint, correct or incorrect? A. False. B. True. Meaning of distal. A. Further from the head. B. Closer to the trunk. C. Closer to head. D. Further from the trunk. How many acetyl-CoA molecules can enter the Krebs cycle from a single glucose molecule during glycolysis? A. 3. B. 4. C. 1. D. 2. What are the 2 major myofilament kinds can be discovered inside a myofibril? A. Actin, titin. B. Myosin, titin. C. Actin, myosin. Which position on a barbell curl by an athlete has the most extended moment arm of resistive force? A. At the uppermost position of the exercise. B. No change in moment arm length throughout the range of motion. C. At the bottommost position of the exercise. D. At the midpoint of the exercise. One of 2 routes is open to pyruvate molecules after anaerobic glycolysis. Which pathway will the pyruvate molecule take if the oxygen supply is scarce and the cell has high energy requirements? A. Lactic acid fermentation. B. Glycogenolysis. C. Gluconeogenesis. D. Krebs cycle. The longer the moment arm of muscle force when working with levers. A. The shorter the moment arm of the resistive force. B. The less force needed to overcome the resistive force. C. The longer the moment arm of the resistive force. D. The more force needed to overcome the resistive force. Which of the following regions houses the body's glycogen stores in a larger quantity? A. Muscle. B. Liver. C. Adipose tissue. D. Brain. If the blood's oxygen partial pressure is low and the alveoli's partial pressure of oxygen is high, as oxygen moves, A. From the area of high partial pressure to the area of low partial pressure. B. From the area of low partial pressure to the area of high partial pressure. True or false, the mechanical advantage of a second-class lever over a muscle force is always more significant. A. True. B. False. Rocky is a guy college student who is 22 years old. He runs for fun, but he wants to improve his time in a future 10-kilometer race. In order for him to train the proper energy system, what range of work-to-rest ratios will you suggest? A. 1:3 to 1:4. B. 1:3 to 1:5. C. 1:1 to 1:3. D. 112 to 120. True or false, skeletal muscle is connected to myofilament, a fibrous connective tissue. A. True. B. False. Which of the following doesn't represent a particular kind of muscle action? A. Eccentric. B. Concentric. C. Plyometric. D. Isometric. The body uses 3 different sorts of energy systems to produce energy. Which of the 3 energy sources uses only anaerobic processes? A. Phosphagen. B. Glycolytic. C. Oxidative. Muscle fibers of type IA are: A. Red-white. B. Red-white. C. White. A muscle that agonists: A. Indirectly assists in a movement. B. Slows down or stops a given movement. C. Is primarily responsible for a given movement. What is the name of the intensity level at which the blood lactate concentration abruptly rises above the reference value? A. VO2 max. B. Lactic acid fermentation. C. Onset of blood lactate accumulation. D. Lactate threshold. What is the name of a muscle cell's membrane? A. Sarcolemma. B. Epimysium. C. Sarcoplasmic reticulum. D. Transverse tubule. An electrocardiogram measurement by the machine shows heart ventricular repolarization. A. T-wave. B. P-wave. C. QRS complex. What changes could occur with regular aerobic exercise? A. Rise in percentage of body fat. B. Rise in ATP stores. C. Rise in capillary density in muscle fibers. D. Hypertrophy of type 2 fibers. Which of the following is referred to by the size principle? A. Mitochondrial density. B. Muscle fiber length. C. Angle of pennation. D. Motor unit recruitment order. Which anatomical plane is where the vertical jump is generally carried out? A. Coronal. B. Sagittal. C. Transverse. D. Frontal. What electrical events aren't picked up by a typical electrocardiogram? A. Atrial repolarization. B. Atrial depolarization. C. Ventricular repolarization. D. Ventricular depolarization. Which of these hip motions during skating requires the gluteus maximus in a hockey player? A. Hip flexion. B. Internal hip rotation. C. Hip adduction. D. External hip rotation. Where are the Golgi tendon organs and the muscle spindles located, respectively? A. Tendons. B. Tendons and muscles. C. Muscles. D. Deep fascia. In what bodily systems does the series elastic component NSCA predominantly store energy for plyometric action? A. Ligaments. B. Tendons. C. Joints. D. Muscle fibers. Which of these acts best characterizes transverse plane shoulder abduction? A. Volleyball dig. B. Backhand tennis stroke. C. Basketball pass. D. Boxing jab. Which of the following activates the spindles and muscles? A. Muscle tension change. B. Muscle size change. C. Force output change. D. Muscle length change. Which of the following describes the process of boosting red blood cell mass artificially? A. Blood transfusion. B. Oxygen surplus. C. Blood doping. D. EPO. Which of the following muscles, the supraspinatus, infraspinatus, subscapularis, and teres minor, stabilizes which joint? A. Glenohumeral. B. Acromioclavicular. C. Scapulothoracic. D. Patellofemoral. Which joint is jointly supported by the supraspinatus, infraspinatus, subscapularis, and teres minor? A. Phosphogens. B. Branch-chain amino acids. C. Lactic acid. D. Glucose. Which knee structure is most susceptible to harm when engaging in weight training? A. ITB. B. Patella kneecap and surrounding structures. C. MCL. D. ACL. Which of the following is increased by aerobic exercise? A. Maximum RFD. B. Serum testosterone. C. Resting heart rate. D. ATP stores. Where is the trapezius located with relation to the latissimus dorsi? A. Superior. B. Dorsal. C. Posterior. D. Inferior. What joint movement causes the radius and ulnus angle to increase? A. Hyperextension. B. Flexion. C. Adduction. D. Extension. An increase in the rate of force generation affects the force-velocity curve in what way? A. The curve is unaffected. B. Left shift of the curve. C. Shifts the curve to the right. D. Increases the peak of the curve. What position should you be in to begin an abdominal crunch? A. Prone. B. Inverted. C. Supine. D. 5-point body contact. What kind of stretching involves a rebound-like action and active muscle activation when the final posture is not maintained? A. Static stretch. B. Active stretch. C. PNF stretch. D. Ballistic stretch. Which quadriceps muscle is situated closest to the body's centerline? A. Rectus femoris. B. Vastus intermedius. C. Vastus medialis. D. Vastus lateralis. Which of the following describes how the latissimus dorsi opposes it? A. Deadlift. B. Chin-ups. C. Dumbbell overhead press. D. Back squat. What kind of response causes an energy release? A. Anabolic reaction. B. Exergonic reaction. C. Endergonic reaction. D. Delayed reaction. Which aspect of the heart is often damaged in someone with persistent tachycardia? A. Conduction system. B. Bicuspid valve. C. Tricuspid valve. D. Atria. Which of the following is a sports psychology objective? A. Measuring psychological phenomena. B. Investigation of the relationship between psychological variables and performance. C. Applying theoretical knowledge to improve athletic performance. D. Diagnosing athletes with suspected psychological disorders. Which of the below claims is untrue? A. Excitement, motivation, and confidence can be beneficial emotions. B. Excessive emotion in either direction can be harmful to performance. C. Maximal arousal is needed for optimal performance. D. Athletes must learn mental skills to accompany physical skills. Which of the following describes arousal? A. Athlete heart rate and blood pressure elevated. B. Associated with unpleasant events. C. Occurs independently of hormonal levels. D. Arousal is always present on a broad continuum. Which of the following describes anxiety that shows itself as bodily signs like an increased heart rate and stiff muscles? A. Cognitive anxiety. B. Somatic anxiety. C. State anxiety. D. Trait anxiety. Which of the following best describes trait anxiety? A. Lack of physical and psychological efficiency. B. Enduring personality disposition towards perceiving an environment as threatening. C. Acute subjective experience of apprehension and uncertainty. D. High degree of ego involvement and perceived threat to self-esteem. Which of the below claims is untrue? A. Stress is always associated with a decrease in performance. B. Stress represents a substantial imbalance between demand and response capability. C. Perception of stress largely determines the resulting performance effects. D. Stress generates arousal. Which of the following statements is false? A. Muscle mass can limit mobility. B. Resistance training decreases flexibility. C. Greater stretch tolerance is associated with greater ROM. D. High flexibility is not be needed for every athlete.